Okay.
Sure.
Hi, good evening, everyone. Can you please confirm whether the audio and video is fine when whether you can see both of us? Because I can't see it.
Yeah, it's not live, sir. I think it's just coming. Dr. Bhatia, Gurukul coaching. हाँ सर आ गया सर.
Okay. Yeah. So, welcome to this session on DBMCI FMG channel. And first of all, congratulations to all those who have passed the FMG exam, which was recently conducted. But I assume that this session is predominantly being attempted by or attended by those who, because of whatever reason, could not crack the exam. So let us take half an hour to identify that what went wrong, what were the areas that we need to look at, because one thing is clear, we have to crack the exam, right? There is no doubt about it. That is the plan that we have, and that's plan A, and there is no plan B. We have to crack the FMG screening exam. So let us identify that what were the challenges, what were the things that we need to do. So I am being joined by your favorite Dr. Aditya. So Aditya, welcome.
Hi, sir. It's always a pleasure to have these sessions with you.
Yeah.
And hopefully, the students who are watching this will gain something out of it. And like you said, sir, मतलब crack तो करना ही है. We have to crack the exam. And after this session, they learn from their mistakes. Mistakes, मेरे पापा हर बार ये बोलते थे कि गलती सब करते हैं. But the intelligent person is the one who learns from their mistakes. So they should learn from their mistakes. So,
Yeah.
ठीक है, it's okay if you could not crack it this time. But that is not an excuse that you don't crack it next time or next to next time. That should be the goal of the session.
Yeah. And I will also add one more point is very, very rightly said that please learn from your mistake. So if you have written the exam this year, learn from your mistake. And if you're writing it for the first time, let's learn from the other's mistake also so that we are not committing those, right?
Mhm.
So let me just do some briefing about, I think around 40,000 students were appeared for the exam and the passing result is around 24%. So that means I can say that roughly around 10,000 people cracked the exam. So that means 30,000 people were or could not crack the exam, right? Now, out of those 30,000 people, the broad data is that the student, almost 50% of them, that means 15 to 16,000 people have scored between 125 to 149 marks. That's the rough data that I have with me, right? Now, if I if I talk about the exam, what is the fundamental difference that is happening in the exam is that the exam is becoming more and more clinically oriented. I still remember when in 2009, 2010, when I used to teach, that means 15 years back, FMG screening exam was predominantly focused on one-liners. It was a complete rote learning. One liners used to come, and out of 300 questions, I will say that more than 250 used to be one liners. There were no images, nothing. Then the pattern got changed. Some images used to be there, and then again, this was more of rote learning images. But for the last 3 years, what is happening is that the questions were more clinical. The questions, and in fact, I will tell you that I don't see much of a difference between the way that the questions are asked in the NEET exam as
Hmm.
well as the question that are asked in the FMG screening exam. Rather, some of the questions in the FMG screening exam are relatively more tougher in comparison to the NEET PG exam.
In fact, I would say, sir, some questions of FMG are then directly picked and repeated in EPG also. This is also happening.
Is it happening in pediatrics also?
Yes, sir, it's happening in pediatrics also.
Happening in radiology also, and I keep on telling it to everyone that make sure even for the NEET PG aspirant that last 2 year
Hmm.
of FMG screening exam you're going through. And in fact, the new question that have come up in the last 2 year of the FMG, I make sure that I'm telling them in my class as a potential question in the
For
NEET
the
exam.
NEET exam. I've been doing the same, sir. Just yesterday took a class in Calicut and told them about at least two, three extra pointers which I felt were asked in this FMG exam. And then there is a very good chance they might just ask this in INI-CET or I might ask as far as the coming NEET PG in August is concerned.
Yeah.
But what sir said I would say, sir has given a very brief and sir has given a very correct picture. The exam has changed. So your preparation should also change, most importantly.
Yeah.
Right? It is no longer a rote learning exam. All right. It's no longer, sure, the question and the topics are still the same. They are still asking those important things they expect you as a doctor in India. Right. So that's why the questions related to, for example, if I'm talking about pediatrics, the focus will always be more on malnutrition and nutrition, vitamins, because they know these are things which are very, very common. They might not be as common as in the foreign nations, but they're very common here in India, and they will ensure that they ask these questions. The topics have stayed the same, but now they have asking in a manner that, oh, you are a pediatrician and you are seeing a child. That kind of question they are giving you, and they are expecting you to answer those questions.
Yeah. Yeah. So, Aditya, correct me if you think that there is a discordance between both of us. I believe that one of the biggest reason and biggest difference in the preparation, and specifically the student who have got marks between 125 to 149, is that, and my experience also has been that the student who are preparing for the FMG screening exam, they are afraid of solving questions.
100%,
I
sir.
mean, even NEET PG aspirants are also afraid of solving questions. I will not say that they are not afraid of solving questions, but somehow their broad training has been that everybody tell them, अभी theory कर लो and end में questions कर लेना. Right? Towards the end, do more questions, and वो end कभी आता नहीं है because वो theory कभी खत्म ही नहीं होती. They keep on delaying, 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 and at the end they do very, very few questions. And that is why, in spite of having a relatively decent knowledge of the theory, but when it comes to MCQ and it comes to the four choices, their brain is not trained and their brain is not well tuned to pick up the answer that is given from the four choices, in spite of knowing the theory, in spite of telling them, "Okay, acha, write down a short note." They will write down a short note.
And maybe
But
better short note than some of the Indian students also, I
yeah,
would say.
yeah, yeah. No,
The
so that
theory
is
actually.
always there. That is always there, and I know I might be criticized on this particular part, but I'm telling you the way that the FMG screening exam is coming up right now. If it is to be put to everybody, I will be surprised that if the Indian medical graduate score is more than that. Yeah.
Definitely, sir.
So
But
yeah,
the theory is fine. Absolutely. The problem with FMG is what happens that because they're trying to complete their preparation in 6 months. For example, if I take the January preparation, uh, doesn't matter whatever platform they're doing it from. So what happens? They're like, okay, let's first complete the syllabus, which is fine. So in that process of completing the syllabus, by the time they think they have completed the syllabus, it's already August end or November end, right? Now they're like, oh, let me just revise it so that I retain the information, which is also fine. Yes, you have to revise, otherwise you won't be able to retain the information, not get the answer correct in the exam. But in this process, they completely forget about the fact that MCQs also need to be solved. Right.
yeah,
And a
yeah.
little different type of MCQs. They probably would be doing the FMG PYQs. Definitely, they must have been doing that. No doubt about that. But similar questions and questions related to them, a little more making those one-liners which are asked 4 or 5 years ago, converting them into a little more clinical question. Like instead of asking for, let's say, I'll give an example from pediatrics. Instead of asking what are the three Ds of pellagra? This was a very famous question in FMG, very easy question, three Ds of pellagra, not a 3D of pellagra. The question has now shifted into they will give you a clinical picture of a person having the castle's necklace, or they'll simply say a person has come with diarrhea, he has come with memory loss, he has come with uh, some and skin lesions all over his wo. And instead of directly saying diarrhea, dementia, and dermatitis. So that kind of the very small fine tuning of the question has been there, but because they have not practiced that on the exam day, they are not able to get the answer correct. They know the theory, but they are not able to mark the answer correct because of lack of MCQ practice.
So what I'm gonna do is let us think about that today we are at 4th of February, and I think the date has broadly been announced. It is, I think, last week of June, 30th June, something like this, right? So we have roughly around 150 days, now 145 to 150 days that we have in our preparation. So what can we do so that we can turn the table, right? Instead, I remember nowadays I don't see the scorecard, but I always used to say that if you're preparing for the FMG screening exam, you should have only one aim, and that is you should see your name or result with the green color. Because do you know what used to happen is that the pass used to be written with the green color and fail used to be written with the red color. So I say just your result should be with the green color. So what can you do so that you can go beyond 150 in your exam? That should be the primary target. Now, after that 150, 160, 170, I will, after 150, the second target should be 165 because that makes you eligible for
For
the
INS,
INSE.
NSET.
Right. And after that, every extra marks is a bonus. Any extra mark that you're gonna get is give you some more happiness. That's all. But the first target has to be that it should be 150 plus. So what should I do if I would have been at your place? I would have actually thought about it, that what is my real score. And now I would not have blamed the board. I would not have blamed the mark or a non-transparency. I would have really thought about it that this is my real score and what can I do to make it better. And I will divide it into three groups. Group number one, the student who have got less than 100 marks. Second, the student who have got a marks between 100 to 125. And the third, that the student who have got marks between 125 to 149, right? And that is how the three groups broadly I'm going to divide. According to me, that the student who have got less than 100 marks, that means their basic understanding of the subject lacks at this point of time. And they have to make it strong. The student who have got more than 125 marks, that means their theoretical knowledge is relatively okay. I will not say it is in the best of the world, it is relatively okay. What they lacked majorly is MCQ practice. So their focus should be to revise the notes and practice MCQs. Now, students who are there between 100 and 125 should think about it, that what was the reason. Have you gone to their old concept कि 8 सब्जेक्ट पढ़ के चले जाओगे तो FMG एग्जाम क्रैक हो जाएगा, right? That used to be an old thought, that just do 10 subjects and then you will be able to do that. Have you completed all your 19 subjects, or have you not completed your 19 subjects? And according to that, this is gonna be there. So Aditya, if we are on the same page in this, I think that is how let us divide and let us break them down into the student who have got less than 100, between 100 to 124, and between 125 to 149. Like, can we have some comments in the students who are attending this session? What was your range, right? Which group you belong to, and according to that, we will pick it up and we will go more elaborative on that particular group, right? So just group one is less than 100, group two is 100 to 124, and group three is 125 to 149. What do you think is the group? Okay. Yeah. So this is very important area 147, 145. I believe that there is not much difference in the in terms of knowledge, the student who has got 145 and the student who has got 153. Right. The knowledge is broadly same. It's about just those 5 or 8
So
questions.
major of the people are from group 3. Occasional group 2 people are there who
Yeah.
got 120, 123. But majorly people are 140, 149,
First, let's take the
148.
group three. So, according to me, the group three student already have their broad notes ready with them. What they have to do is they have to thoroughly
In
read.
fact, say one person is specifically saying, and I think this is the best example. He said that I have done my offline coaching. My score is 140. Should I join a new coaching all over again? Like,
Uh, yeah, you go ahead, please.
yes, sir. So I would simply say to you, I think his name is
Yelendra. Yelendra.
Yelender 8984. Like, you need not change your original source. As far as your main notes which you made from your original coaching, it could be anything by the way. You need not do that. That is absolutely not required. You need to revise those notes again. What you need as of now in this from February all the way till June when the exam occurs, these 140, 150 days that you have left, it is MCQ practice. It is more and more MCQ practice along with, and not just blind MCQ practice. A lot of people when they hear the word MCQ practice and PYQ practice, like चलो रट लेते हैं क्वेश्चन के इसका आंसर सी होगा, they will remember, oh, it's C, it's B, something like that. No, MCQ practice with understanding why that option is correct, and more importantly why the other three options are incorrect. If you have that MCQ practice with the understanding how an MCQ is framed, your score, this 140 score, I can give it to you writing. If you practice your MCQs properly, do your previous year FMG PYQs 5 to 7 years properly, and you revise your notes, next time this 140 will turn into 170, 180. Right?
Absolutely, yeah, absolutely.
100%.
And one more point that I want to say, Aditya, I mean, the easiest thing right now for both of us to say that we are the best people, we are the best teacher. Nobody can beat us in radiology, nobody can beat you in pediatric. There is no doubt, right? That's the easiest thing that we can say. But my 20 year of teaching experience says that more or less, more of all of teachers are same. Everybody is doing a lot of hard work for you so that you can reach to your goal. So actually, we don't matter, it's what you matter. You are the one who matters, how you are using it. Identify and solving those questions is going to be a very, very big thing. So my request to everyone is that if you could not crack, that does not mean that it's a fault of just your notes. It's more about now practice a lot more MCQs, and that is why specifically for this year, exclusively for FMG screening exam, we are introducing a test and discussion program, our signature program, who have helped lakhs of the students in cracking the PG entrance exam, but there was no formal dedicated TND program
I
that
think so.
exists
You have said that the only coaching you have attended is
as
a
a
test and
TND.
discussion, and the same goes for me also. The only coaching I have attended has been a test and discussion. Like it goes without saying that if you are someone in the 125 to 150 range, your concepts are clear, or at least not clear, you definitely have average to above average concept. What you lacked was MCQ practice. So the person who asked Yelender, for example, you need MCQ practice. Even if, for example, you decide, "Arey, obviously we are from here, from Bhatia, we are making video related to, we are from DBMCI one, we're making video related to our test and discussion. I am a student of that. Dr. Rajat has been a student of the same program, and now we are teachers in the same platform. So we can vouch for it. Having said that, even if you're like, oh, this is a conflict of interest and everything, you don't require change in your original notes. You require MCQ practice. If you are someone who got between 125 to 150 and right now is thinking what to do next, a test and discussion with having teachers tell you why this option is correct and why this option is incorrect is tremendously going to boost your score, obviously along with MCQ practice.
Yeah. No, absolutely, absolutely correct. एंड पिंक मूनलाइट टॉपर्स की बात नहीं कर रहे बच्चे, सिर्फ उन बच्चों की बात कर रहे हैं, क्योंकि टॉपर की कोई डेफिनेशन ही नहीं है आज की डेट में ना। टॉपर की क्या डेफिनेशन होती है? इट्स अबाउट वेदर यू आर एबल टू रीच टू दी guide the thought process that you have decided for yourself or not, right? So this session is exclusively for the students who are planning to write the June FMG screening exam, and majorly focusing on the students who have appeared the exam this year and because of whatever reason they could not crack the exam, right? So Daksh, what you are mentioning, bache, 147 and 146 is slightly unfortunate. That is what I will say,
That's
right?
it.
It's just unfortunate. Trust me on this, bache. There is no difference in knowledge between you and somebody who has got 151, 152. But there is always a threshold that they have to decide, right? I always wish a student who has got between 145 to 149, they should be allowed to pass. But the problem is, then what to do with 144? So at one point, they have to draw that threshold. And whosoever will be just below that particular threshold will exactly have the same pain. And I'm telling you, a lot of time we also have the same pain as you are having, right? Because you can never see the thought process of us as a teacher. We become more attached to you, we become more I will say from within, that how our students are performing, right? Those are the things that inherently become a part of our life, right? So for you, I will say that there is nothing in wrong in your preparation. It was not a great day, probably. Just practice the MCQs for the next 5 months, and I'm telling you, you are sorted. You will definitely be sorted. You go and assess that what kind of how many MCQs that you did in the day. But one more point that I want to tell you is that just merely taking up a course and thinking now I'm doing TND is not going to help you. When you talk about a TND, it has got a component which is test and discussion. Like, for example, from 13th of February, your TND will start. There will be a test. You're supposed to write the test. And then you're supposed to attend the discussion live, right? A lot of students, what they do is they think TND is also passive learning. Okay. डिस्कशन अटेंड कर लिया, काम हो गया।
They exactly, sir. A lot of students tend to think of test and discussion as ki, okay, I'll attend the discussion part
हाँ,
and think of these as my concise notes,
और
and I'll
एज अ
revise
रिवीजन,
these
एज अ रिवीजन, एज अ
revision notes.
रिवीजन। या
Exactly. I'll use it. No, the test and discussion has two components, test and discussion. You have to, if the exam is on, if the test is on 13, your goal is whatever notes you had. We are not asking you to change your original source, and we are not asking you to take coaching all over again. Whatever notes you have to revise those notes, solve the past 5 to 7 years of FMG PYQs, and then come and give the test and see whether you are able to solve the MCQs that we as teachers have given you. All right, we would have had a thought process in making those MCQs, in making those questions, that why is this correct, why is that not correct. You would get some marks, doesn't matter, good, bad, or whatever. And then when you attend the discussion, then you will understand that how an examiner makes an MCQs. Like when I make an MCQ, what was my thought process in making that MCQ, and why is some option A is correct and why option C is probably incorrect. So if you just attend my discussion, you have essentially skipped over a very important part of the test and assessing your MCQ solving ability. uh, you might as well just watch our one shots. They're available for free on YouTube, right? Or for that matter, any other platform. That is simply you giving us free money and not getting even given getting the utilization out of it. Attend the test, prepare for the test. Three parts, sir. I will not even say two parts. Preparing for the test, giving that test, even if it's a 1 hour test with dedication, and then doing the discussion properly, understanding where the MCQs have been gone wrong and where they have been gone right also. That completes your test and discussion.
I will say that in a test and discussion program, 60% is test, 40% is
Test and
discussion.
discussion.
Yeah, not even half. The much bigger aspect is writing a test, and that is an area that we have to focus upon. Okay, so let me give you an example. A student, Smriti, has asked her, can you explain with an example on how to make ourselves understand in a question why the option is correct and why the other option is wrong? See, देखो क्या होता है बच्चे, कोई भी एमसीक्यू क्या है, प्लीज अंडरस्टैंड द ब्यूटी ऑफ एन एमसीक्यू इज आंसर इज रिटन इन फ्रंट ऑफ यू.
Front of you.
What is the worst part? You have to pick up only one answer from those four choices. It's not a वाइवा कि आपको दो ऑप्शन में कंफ्यूजन है, आप एक आंसर धीरे से बोल दो. अगर ठीक है तो एग्जामिनर कहेगा हाँ हाँ ठीक से बोलो, और अगर बोलेगा तो आर यू श्योर, यू सडनली चेंज योर आंसर. दिस इज नॉट समथिंग दैट कैन बी डन. ओके, लेट मी टेक यू एन एग्जांपल. ठीक है, एक एग्जांपल देते हैं कि एक पेशेंट है, वो डिमिनिशन ऑफ विजन के साथ प्रेजेंट किया और एमआरआई ऑफ ऑर्बिट किया. एमआरआई ऑफ ऑर्बिट में ऑप्टिक नर्व वाज फाउंड टू बी एनलार्ज्ड. There is an enlargement of the optic nerve which is globular, right? Now, the moment there is a diminution of the vision, optic nerve was found to be globularly enlarged, that you are thinking that there is a tumor in the optic nerve, right? So what will happen is, now you read the options. Now one option is written as optic nerve glioma, another option is written as optic nerve sheath meningioma. Like, let's say one option that is written as a glioblastoma multiforme, and another option that is written is as a let's say a pilocytic astrocytoma. नाउ यू नो कि भाई पाइलोसिटिक एस्ट्रोसाइटोमा और ग्लायोब्लास्टोमा मल्टीफॉर्म तो ऑप्टिक नर्व में होते ही नहीं है,
होता ही नहीं है.
तो ये तो आउट ही हो गए. तो अब क्या बचे? अब बचे ऑप्टिक नर्व ग्लायोमा और ऑप्टिक नर्व शीथ मेनिंजियोमा. अब इनमें से क्या है? एक करेक्ट आंसर है और एक डिस्ट्रैक्टर है. प्लीज अंडरस्टैंड दिस, राइट? वन इज अ करेक्ट आंसर, अनदर इज अ डिस्ट्रैक्टर. दो तो रैंडम चॉइसेस है. जब आप ये बोलते हो ना कि सर मेरे को दो ऑप्शन में कंफ्यूजन हो जाता है और एवरी टाइम आई पिक अप वन आंसर, द सेकंड इज, that is how the MCQs are being prepared. All the clinical MCQs are being prepared in this particular way, that a student who knows the thought right will always pick up the right answer, and the student who doesn't know will always pick up the wrong answer. And that is the biggest area. अब हमें क्या करना है? अब हमें पता होना चाहिए कि अच्छा ओके, ऑप्टिक नर्व ग्लायोमा और ऑप्टिक नर्व शीथ मेनिंजियोमा, हाउ दे आर डिफरेंशिएटेड. So how they are differentiated? Optic nerve glioma will originate from optic nerve, and optic nerve sheath meningioma will originate from the nerve sheath. And as it is originating from the nerve sheath, optic nerve will be seen in the center as a black line. तो अगर ऑप्टिक नर्व दिख गई तो क्या है? ऑप्टिक नर्व शीथ मेनिंजियोमा. एंड इफ ऑप्टिक नर्व इज नॉट सीन तो क्या हो गया? ऑप्टिक नर्व ग्लायोमा. और इस साइन को क्या बोला? ट्रैम ट्रैक साइन. Done. Up, what are the questions that can be there? Tram track sign on an MRI of the orbit is a feature of one liner. Answer: optic nerve sheath meningioma. Clinical scenario: MRI image is given, tram track sign is shown, optic nerve sheath meningioma. Optic nerve is enlarged, but tram track sign is not seen, optic nerve glioma. Are you getting it? So this is the fundamental way that the questions are being prepared. 34-year-old patient presented with fever, convulsion and altered sensorium. ठीक है, 34-year-old पेशेंट है, फीवर का मतलब इन्फेक्शन है, कन्वर्जन ऑल्टर्ड सेंसोरियम मतलब इन्फेक्शन कहां का है, इन्फेक्शन ब्रेन का है, तो क्या बन गया, एनसेफेलाइटिस. An MRI of the brain is done and shows involvement of bilateral frontal and temporal lobe. इन्वॉल्वमेंट ऑफ बायलैटरल फ्रंटल एंड टेम्पोरल लोब. अब आप सोच रहे हो अच्छा एनसेफेलाइटिस है, ऐसा कौन सा एनसेफेलाइटिस है जिसमें फ्रंटल और टेम्पोरल लोब इन्वॉल्व होते हैं. ऑप्शन क्या दी हुई है, हर्पीस एनकेफेलाइटिस, जापानीज एनकेफेलाइटिस. herpes encephalitis, Japanese encephalitis, and similar. Immediately you think अच्छा वो frontal and temporal lobe involvement किसमें होता है, herpes में होता है. अगर थैलामिक इन्वॉल्वमेंट होता तो क्या हो जाता, तो जापानीज एनकेफेलाइटिस हो जाता. व्हाट विल बी गिवन इन द ऑप्शन, बोथ विल बी गिवन इन द ऑप्शन. वन विल बी द करेक्ट आंसर, अनदर विल बी डिस्ट्रैक्टर. राइट, तो जब आप टीएनडी करते हो तो आप इन चीजों पर फोकस करते हो. देन यू से अच्छा ओ आई मार्क जापानीज एंसेफेलाइटिस, ओ दिस इज एन एरिया दैट आई डिड नॉट पे अटेंशन. ओके, नेक्स्ट टाइम आई एम गोना मेक श्योर दैट आई एम गोना पे अटेंशन टू दिस पर्टिकुलर component. That's an area that we have to focus upon, and that is what I will say.
इनफैक्ट द टीचर्स इटसेल्फ, लाइक आप जैसे बता रहे थे, मेरे को अपना एक टीएनडी का क्वेश्चन याद आ गया जो मैं देता हूँ, मोस्टली देता हूँ, इन विच आई गिव एन इमेज ऑफ अ पर्सन हैविंग हैंड्स में दे आर हैविंग अ पर्प्यूरिक रैश एंड फीट में
Sandeep,
दे
I
आर
will
हैविंग.
I will take your doubt, bache. Yeah, go ahead, go ahead, go
Okay.
ahead. Yeah.
They're having a rash, a purpuric rash on their hands and a purpuric rash on their feet, right? और मैं उनको मुंह की इमेज नहीं देता, and it's a very clear कि it's not a vesicular rash, it's a purpuric rash, and then I ask you them what the cause is. और मुझे पता है सारे, all the students after seeing the hand and the feet, they will think it is hand, foot and mouth disease. I ask the cause and they will mark Coxsackie virus. मुझे पता है, and I want to take them there only. यार देखो मैंने तुम्हें मुंह की इमेज नहीं दी. I did not give you vesicular regions. It is not hand, foot and mouth disease. It is glove and stocking syndrome, which is parvovirus. And parvovirus is a very famous thing जो FMG में बहुत commonly पूछते हैं. Although they ask in a different manner, they ask in the manner of aplastic crisis and everything, but they are very frequently asking questions related to parvovirus. So this, like you said, sir, the examiners, that is we teachers, we make the discussion in the way that you understand that we know that you are going to make this mistake because your thinking is going to be and we want to correct that thinking in this manner. So when that same question or a similar question comes in the exam, you yourself, you can laugh on the exam day and say, मुझे पता है examiner यार, you are trying to get me to mark option B.
आपको
I
एग्जाम में
want to.
एग्जाम में हंसी आ जाती है आपको देख के कि अच्छा
Exactly.
दैट इज हाउ इज ट्रिकिंग मी.
Exactly, that is how it's tricking me. If you're good at MCQ practice, you will have some questions in the exam where you will be like, I know that you're tricking me by keeping this as option A. I know the answer is down below in option B. And this is where the test and discussion comes into the picture. Your theory is fine. If you're making mistakes in MCQs, you feel I know the answer, but हर बार गलत कर देता हूँ. वो दो option भी खराब. I'm always getting confused in those also options. These students basically, if you feel that you belong to this category, you will benefit from a test and discussion.
संदीप तुम्हारा एग्जाम्पल लेता हूँ बच्चे. आप बोलो सर्जरी. अभी सर्जरी में सबसे बड़ा प्रॉब्लम क्या है, एग्जामिनर पूछता है नेक्स्ट स्टेप, व्हाट इज द नेक्स्ट स्टेप इन द मैनेजमेंट इन दिस पर्टिकुलर पेशेंट. एंड मोस्ट ऑफ द स्टूडेंट्स दे हैव अ डिसेंट थ्योरेटिकल नॉलेज. मैं एग्जांपल कहता हूँ, इसोफेजियल कैंसर. मुझे बताओ एनीबडी हु कैन टेल मी व्हाट इज द नेक्स्ट स्टेप इन द मैनेजमेंट इन अ पेशेंट विद इसोफेजियल कैंसर. या आपके तरीके से करता हूं, इसोफेजियल कैंसर का क्वेश्चन आएगा तो बताओ क्या इन्वेस्टिगेशन मार्क करनी है. दैट इज हाउ पीपल मेमोराइज, बट कर ही नहीं सकते आंसर. राइट, तो लैंग्वेज देखनी है. कैसे देखेंगे, पेशेंट will not come to me with esophageal cancer. Patient will come and say, Doctor Sahab, I have difficulty in swallowing food. I have a weight loss and difficulty in swallowing the food for the last 3 years. डॉक्टर को देखते थोड़ा समझ आ जाएगा इसोफेजियल कैंसर है. तो व्हाट इज द नेक्स्ट स्टेप नाउ, द नेक्स्ट स्टेप इज बेरियम swallow. You do a barium swallow, right? A barium swallow is done and there is an irregular narrowing at the distal end of the esophagus. That raises a suspicion of esophageal cancer. Now what is the next step? Now the next step is biopsy. Now what biopsy will do? Biopsy will confirm the cancer. Now once the cancer is confirmed, what is the next step? So once the cancer is confirmed, then your step is staging, because staging will decide the treatment. Are you getting it? So once the cancer is proven, till the time cancer is not proven, what is the best way? biopsy to confirm. But once the cancer is proven, now your next step will be staging. Now what are the components of staging? T and M. ठीक है ना, टी एन एम. अब इन तीनों में से सबसे इंपॉर्टेंट क्या हो गया? एम. वाई? क्योंकि एम वन है तो टी और एन इरेलीवेंट. द मूवमेंट एम इज वन, टी एन एन आर इरेलीवेंट. तो कह रहा है भैया मेटास्टेसिस देख लो, स्टेज 4 तो नहीं है. वो कौन बताएगा? पेट सीटी. राइट. सो आफ्टर बायोप्सी, पेट सीटी और सीईसीटी, depending on whether PET CT is available or not. Now, PET CT shows metastasis, stage 4. PET CT does not show metastasis. Now I have to look at surgical resectability. कि न्यू एडजुवेंट कीमोथेरेपी दूं कि सीधा ही सर्जरी कर दूं. इसके लिए क्या देखना है? इसके लिए देखना है कि व्हाट इज द इन्फिल्ट्रेशन ऑफ ट्यूमर अलोंग द इसोफेजियल वॉल. ये कौन बताएगा? टीईई, ट्रांस इसोफेजियल इकोकार्डियोग्राफी. TEE, yeah, endoscopic ultrasound, whatever you want to say, both are same. EUS, endoscopic ultrasound. So the point to be noted is, in a patient with esophageal cancer, what could be the answer? Barium swallow, biopsy, PET CT, CCT, endoscopic ultrasound. But it depends the way that
Question
the
framed.
question is structured. Most of the student, they fail to understand the way that the question has been structured, and they have just memorized. इसोफेजियल कैंसर का क्वेश्चन आएगा, ओह मेरे को बायोप्सी मार्क करना है, बेस्ट हुआ तो बायोप्सी होगा. नहीं, बेस्ट इन्वेस्टिगेशन टू स्टेज एन इसोफेजियल कैंसर कैन नॉट बी बायोप्सी. बेस्ट इन्वेस्टिगेशन टू डायग्नोज एन इसोफेजियल कैंसर
Will
विल बी
be
बायोप्सी.
biopsy.
Are you getting it? So those are the areas that you have to focus upon. But please remember, this says when your score is between 125 to 149, 120 to 149. If your score is less than 100 in the exam, right, then this is majorly either you have not completed your subjects, then you have to read the subjects thoroughly. Then first thing is you have to read it very, very thoroughly. But if you are into this particular category group, 120, 125, a lot of time when I say 125 to 149, students say I am got 124. What should I do? So there are always gray zone. Assess yourself on the basis of this, and I am telling you, you will 100% see pass in front of your name. Aditya, over to you.
Yes, sir. I think I have nothing, no difference of opinion. I have to be very honest. The entire point of 125 to 149, like one person has said, sir, I scored 139 in my first attempt. मैंने कोई subject नहीं छोड़ा. I did not give any question. I did not give any PYQ and gave around 8 GTs, and I was scoring well in those GTs. I was getting 180, but on the exam day I could not pass. I don't know how to go on. So, like sir had said, sir, unfortunately, we understand your pain. Like probably just the exam day was bad. Like there is no doubt about that, that there is a very good possibility. Simply on the exam day, you did not do well. Second possibility, I would say, maybe you did your pre-IQs properly. Maybe there were few, some, you, obviously you know this yourself. I don't know how your preparation went and everything. Maybe for some major subjects, maybe for medicine, maybe for pediatrics, maybe for pathology, in some subjects, there were few questions and few concepts you thought you had done, but your concepts were wrong. On the exam days, those concepts were asked a little more. Sometimes some questions asked a little more. And in all those questions, you got the answer incorrect, unfortunately, on the exam day. Essentially, exam day was not your day. Again, your goal is simply, you know the recalls, you know the 300 question, you know where you made the mistakes. What were the silly mistakes and what were the mistakes? What were the silly mistakes and what were the mistakes you felt that you knew the answer, but on the exam day you could not recollect, or maybe you could not revise properly. You just need to improve on those mistakes. You know your mistakes. Sure enough, it was your first attempt. That's why you got 140. Not that's not the reason you got 140. You got 140. You know your mistakes. Please just improve upon your mistakes. You're already at the finish line. You just need to push yourself to get to the finish line. What we are saying essentially here is that people who are in the 125 to 150 zone, 70 to 90% of the time, these students, their mistake is the theory has been fine. Revision also was more or less okay. They did not know how to solve the MCQ on the exam day. They knew the answer when they were doing the recalls. They were like, yes, 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 I had learned about this. But on the exam day, in those 3 hours, in those 6 hours, they were not able to mark the MCQs correctly. And for this specific set of group of people, if you feel that you would belong to the set, that during recall you were like, oh, I knew this, but the answer turned out to be this. Oh, I knew this, but the answer turned out to be this. If this was happening for you for some 15, 20 questions or 30 questions, which is the difference between getting a 140 and 160, you will definitely benefit from a test and discussion, because this is the small thing which is lacking. If you do this, you will definitely next time score 165 or 170 plus the ones which you are getting in GT. The difference between a GT and an actual exam is one difference is exam day there's always a more tension, right? Some people perform better because of the tension, 10 marks extra. Some people get 10 marks low. That's the one thing. Second thing is sometimes simply luck. We underestimate luck a lot. Sometimes simply it's your bad day. That's the only thing. So if you're asking what did I do wrong, I have two answers for you. You yourself know what you did wrong. You know your mistakes. Learn from those mistakes. B, it's very possible you did everything right and it's for simply bad luck यार और कुछ नहीं था.
Akku bache, if you were scoring 170 to 180 correct in the GT, and these were non-recall based or non-PYQ based GT, uh, it was a bad luck. Write the exam again. Just be consistent with solving questions, and I can give it to you in writing. You will pass the exam. Right now, how to approach QBank? VK has asked this. So VK, I want you to go to the interview that I took of a student Vishal, and I must mention that I've become his fan. Right, I will be reaching out to him again. So Aditya, he was a student who suffered because of Ukraine-Russia war, and he was shifted from Ukraine to Russia, and he was more inclined towards chilling and maybe little bit preparing for USMLE. Did not buy any app subscriptions during the MBBS. Came back to India and did not want to leave the home and joined DBMCI live program. And he said all that he was did was blindly follow DBMC live program, live 360. And he said that the subscription of MarrowQ Bank was given along with that. So he was solving that. For a lot of time, what used to happen is he used to get the question that has not been covered in the class. And he used to get FOMO. And every time when he used to get FOMO, he used to say only one thing to himself कि टीचर बेवकूफ़ थोड़े ना है. अगर टीचर ने नहीं पढ़ाया, इतने एक्सपीरियंस टीचर से, अगर उसने नहीं पढ़ाया तो कोई तो रीज़न है ना कि उसने नहीं पढ़ाया, तो छोड़ दो, इंपॉर्टेंट ही नहीं है. राइट, जितना उन्होंने पढ़ाया है और पीवाईक्यू है बस वही इंपॉर्टेंट है.
Very true. Very true.
आई हैव बिकम हिज फैन, आई एम टेलिंग यू.
Absolutely.
Right, and I am telling you, I will be inviting him to guide our FMG students. That is the kind of conviction that you have. It's been 20 years. अगर मैं कुछ नहीं पढ़ा रहा तो रीजन है उसको नहीं पढ़ा रहा. राइट, अदरवाइज आई वुड हैव taught you that whatever that the teacher is teaching you, if you're doing those wrong, you have to be worried. But if you're doing anything wrong that is neither a PYQ nor a teacher has taught you, you should not be worried.
This is
You should not be worried.
this is not just us, by the way. Like sir said in the beginning, all teachers
Anybody.
are equal.
Yeah.
If you have
See,
already done your coaching from some other platform, any platform for that
I
matter, you have
am
your
not
notes.
here to tell you that I am the best teacher or Aditya is
Yeah.
the best teacher. I am not. I am beyond that league now. I am not here. Even I don't think that Aditya is here to prove that he's the best teacher. I believe that any teacher who has an experience,
Hmm.
who is teaching for quite some years, are more or less same. They are putting their heart and soul for you. They're completely putting their heart and soul for you. So they all are same. But what matters is, are you efficiently utilizing it? Are you remembering the three broad pillar for any exam, and that is revising your notes thoroughly, solving questions, and writing GT. These are the three pillar for solving, cracking any MCQ exam. I mean, irrespective of the MCQ exam, irrespective of the level of the MCQ exam, these are the three basic pillar. Then, depending on the preparation, some accessories are there. If you are preparing for INICT, there are some specific things. If you are preparing for the NEET, there are some specific. But these are the three basic pillar that will remain true for anything, and that is basic. What is called as an art of preparing for any MCQ exam. I mean, that's the crux of this particular session as well.
Definitely. Like you, whatever it was has been like someone said, na, ki mera cube, how will I solve QBank? You have your set of notes, doesn't matter platform. You do the notes, solve the FMG PYQs first because they are the most important. Then solve the important topic modules. In that, if you find any question is outside your notes, let it go. Doesn't matter. Plain and simple. This is a strategy. You solve all the FMG PYQs And now I will say, probably earlier only FMG PYQs would have sufficed, but now I'll say you should do at least 3 years of INIS AT and NEET PG.
Yeah.
You should do at least 3 years of NEET PG and INIS AT. Then solve the important topic modules and the other modules if you have time. And in those modules, if some MCQ you feel is outside of your notes, the ones you had made in the July to January period, don't bother with it.
Mm.
Let it go. It's a useless MCQ. Okay, unless it's a PYQ. If it's a PYQ, that's a different thing. But if it's not in your notes, it's not a PYQ, let it go.
Yeah. So yeah, Nike 123. She has written a very logical point, but sometimes we don't get the concept, so we use different platform for some topic. That is true, bache. Yes. Probably there is a possibility that one particular teacher can make one particular topic very simplified. That is there. Okay, let me give you some examples. Let us take an example of me teaching radiology, right? And let us take an example of a second teacher who is teaching radiology. I'm not naming it just to avoid a controversy, right? So when both of us will be teaching radiology, do you know 80% of the content that we'll be teaching will be same. 80% will be same. 20% of my content will be different and 20% of the content of the second teacher will be different, right? Now let us say 10 questions will be asked from this subject. So do you know 8 questions will be common? One question will be asked from that 20% extra that I have taught, and one question will be asked from that 20% extra that the other person has taught. So that means if you do one source, you will get 9 correct. If you do both the sources, you have all the 10. But the problem is the moment you will do two sources, there is a possibility that you do one extra question correct. But there is a very high possibility that you will do 4 out of those 8 wrong. That's a challenge. So when you think about that there is such a such topper who has done coaching at A place, B place, C place, D place, E place, they don't leave any stone unturned because they have already sorted with that 9. Are you getting it? So in our FMG screening exam, is our aim to know all 10? No, not at all. Because as I told you that I want to see my name with green, and that means I want to get more than 150. And that is done by limiting yourself with one specific source and doing a lot of MCQs. Making sure that all your pre-Qs are done, making sure that you know how to select an answer between the two options. One student has written about that paper 2 May, she got anxious. Yes, this is called a lack of practice. Put yourself in that examination atmosphere multiple time that
That
when you
exam
write the main
doesn't.
exam, it look like a mock test to you. Anxiety will not happen. Anxiety happen when you're doing the things for the first time, second time. But when you're doing the same thing multiple time, then the anxiety doesn't happen, right? The conditioning. You have to condition yourself in a way, right? Those are the very standard things that we should go forward. Yes. Last 5 attempt 122, 110, 133, 133, and now 134. I've taken online coaching twice. I don't know what new change I need. But I I am 100% sure that you have not solved questions. एंड when you saying नहीं सर मैंने क्वेश्चन सॉल्व किए हैं, तुमने कैसे क्वेश्चन सॉल्व किए होंगे? तुमने सोच लिया होगा हर रोज मेरे को 30 क्वेश्चन सॉल्व करने हैं, तो मैं ऐप उठा लेते होंगे और ऐसे क्वेश्चन सॉल्व करते रहते होंगे। हर बार एक आंसर सोचते होंगे, वो ठीक निकलता होगा तो कोई बात नहीं, अच्छा गलत निकला तो भी कोई बात नहीं। हाउ मेनी exams have you written? Subject wise, GT, how many time you have put yourself into the exam? Just ask yourself. You need not to even tell me. Just ask yourself, but I am very sure you have got an answer that this is an area where you lacked.
There must be definite subjects, and I would say big subjects, where you yourself know that when you regularly solve MCQs, you're not getting good marks. For those specific subjects, take a little bit of time, maybe 2, 3 weeks, and get your concepts correct. You can use whatever source. Make those subjects strong. They should no longer stay weak, and then go back to revising your own notes and solving a lot of MCQs. अब 135 पे हो, it means that there is some 2, 3 big subjects in which you are weak. You know that. You already know that which subjects those will be weak. Could be surgery, could be pathology, could be biochemistry, could be pediatrics. take 2 3 weeks. There is no harm in that. You already have your notes sorted. You have already given the exam for 3 4 times. You have your notes sorted. Un 4 5 subjects ko please don't be like,
Hmm.
I'll just do them. I'll get 50% in them. I'll just do PYQs and get done with them. नहीं. Those 4 5 subjects take time and do them properly. एक बार अच्छे से that I'm going to be good in the subject. Solve the MCQs properly and then get back to revising. You will
Yeah.
100% go over that 150 ka barrier.
Yeah, so Lucifer, let me answer your question from 139 to 121. So that means you're broadly in the range of 125 to 130. That is what I'm gonna say. And again, for you also, the test are the ideal thing, right? What Aditya has said, I will agree with him कि हमें 50% के टारगेट पे नहीं रखना अपने आप को. मेरा मिनिमम टारगेट होना चाहिए कि एनी सब्जेक्ट आई एम स्कोरिंग 70% above. That's a target that I should keep. The higher it is, the better it is. But that's a minimum target. And if you think that you're stuck at 40%, 45%, 50%, work more. Work more on that particular area. Take your time, right? So for the student who are asking about the TND program of DBMCI will be an exclusive program for FMG, focused on FMG, that will be starting from 13th of February, and every third to fourth day there will be an exam, right? For a small subject there will be one exam. For a medium subject there will be two or three exams. Like for radiology there will be one exam, but for anatomy, for micro, there will be two exams, and that is how this is gonna be happening. Now what you have to do is, before the test you have to revise your notes very thoroughly. Then you have to make sure that you have to write the test. You have to identify that what are the areas where you went wrong, and you have to make sure that you're attending the discussion. Now we have realized that the one shot program is extremely useful for the students, which is the same one shot program because it's already a concise material which is a must yield or must know topics. So in the TND program a space has been given where you can do that revision, and a one shot program which is a new one shot program where a live program is going to be there will also be, you will be given an access to that, right? The entire set of 19 subjects along with the GT will be completed by 4th of June, and then you will have 25 days to do your very thorough reading. If you're very good at the subject, you can do one main subject and one add-on backend subject in both the days to do your revision. This is an ideal plan for practicing, where you will be solving subject-wise questions, you will be putting yourself into the test, as well as you will be attending the discussion, concising it, as well as you will be having a time for the one-shot program. That is how the course has been designed for you. If you're getting less than 100, I don't see that there is any difference left between the NEET exam and the FMG exam. So nowadays we are offering that the student can enroll for the live DBMCI 360-degree program to build up their concepts. These concepts not just gonna help you in the FMG screening exam cracking, but will also help you in a much bigger task that is lying ahead, which is the NEET PG or the INICT exam also. But that is only for the student who have not built up their concept, who have not made their notes, who are scoring less than 100 correct at this stage, right? So that's the my last messages from this side. Now Aditya, over to you.
I think sir I have covered everything. मतलब nothing extra. आप मेरे जो जो मैं वो बोलना था आप मेरे मुंह से छीन ले रहे थे, मेरे को ये लग रहा था. ठीक है. So nothing extra from my side. My only thing is that if you got like I'll say one thing to you. We need to be a little. I'll say this. Be a little kinder to yourself. This is one thing I'll say. If you're someone who got between 125 to 150, and especially those who got 140 plus, be a little kinder to you. There is a very big possibility you did everything right. Don't think that you did something wrong. It was just not your exam. It was just not the day of your
God
just
is
an
testing you slightly more.
yeah, God is just testing you slightly more. It was just an unlucky day. That is it. Everyone has unlucky days. You had the unlucky day on the exam day. That's the only thing, right? And as a broad strategy, we have already said your goal should not be to change sources. Your goal should not be that this subject I'll do from new teacher, or this I'll do from this teacher, or I'll join a new coaching all over again. Even I'll let people say whatever. You don't want to join us, don't join us. Doesn't matter. Do MCQ practice.
Absolutely.
Do
Correct.
MCQ
Yeah.
practice. Okay. right? We have created a program. It's a structured learning. Basically, that entire point of test and discussion, it's structured. अगर पता होगा कि 10 तारीख को एग्जाम है तो पढ़ोगे, अगर खुद करने की कोशिश करोगे तो हो सकता है मस्ती करने लग जाओ. दैट इज द ओनली डिफरेंस, right? It is structured learning, structured way you will get the test, you will get the discussion. If you feel you can do it yourself, great, but I would say that it's better, एक ही बार की बात है, better if you join. But otherwise, please do MCQ practice if you're in the 125 to 150 zone. Make a schedule. In that schedule you complete. After that you do all the MCQs. You learn from the mistakes of the MCQs. Every 2 3 weeks you keep on giving GTs. You're lacking in MCQ practice, you do that MCQ practice, you'll crack the exam. That's about
Yeah.
it.
Aditya, I always say that basically cracking an exam is a river and you have
Hmm.
to swim across the river. What we are a boat, which helps you in sailing from one side to other side. Now the question is, can you do it without boat? Yes, you can definitely do it without boat.
It's a little tougher.
What boat does? Boat does? It makes your life slightly easy.
Easier.
It makes you more structured. But
Mhm.
the rule is very simple that you have to practice. If you can practice the MCQs yourself, that is the best thing that can
If
happen.
you can have the discipline yourself, that's the best thing.
If you cannot, let us know,
Yeah.
right? Now, the videos of the discussion will be available after the live discussion also, but I will recommend everyone to have a live discussion.
Attend the live discussion. The entire point is, see, you had 4 days, let's say for pediatrics, 4 days for radiology, whatever it is. You read your notes in 4 days, you did the PYQs, then you gave the test. You made the mistakes then and there, and then and there you understood from the teacher why did you make those mistakes so that you don't make them on the exam day. If you postpone it, those mistakes which you did, you might not even recollect why you made those mistakes, what was your thought process which was wrong, and you will not be able to correct that thought process. So give that test. Giving that test is important. If you just attend that discussion, then to I'm saying that you're giving the organization free money. Might as well watch free videos on YouTube that are available, right? Give the test and attend the discussion on the same day.
So for the students who are asking me, sir, why a TND program? Nobody else does a TND program, right? See, we are doing the TND program for the last 20 years in NEET PG segment. And as Aditya has also mentioned, I have also mentioned, I was the only coaching that I have done in my life is a TND program. And I believe that the student who have done the notes, the best improvement that is given is by a TND program, right? And that is one of the biggest reason that this TND program has been given to you. Uh, how it is run, we know it very, very well, right? Don't worry about that. The way that the test will be conducted will give you ample time for your revision, and these last for the exam like FMG screening exam, last 25 days will be sufficient for you to revise it. What is the leftover? So it will be the leftover that you have to revise, and that can be very, very easily, very, very easily done. So don't bother much about it. We know the test and discussion program will be exactly in the same way as your NEET FMG screening exam question comes. So nowadays they will not be one liner, they will be long stem questions, right? And the long stem questions, I think everybody knows how to solve them now. The moment question crosses more than two lines, the first thing is read the last line of the question, then read the options, and then look at the rest of the stem of the question, because by reading the last line and the option, your brain will understand what is the examiner trying to ask you. Then you're gonna go to the rest of the stem of the question, then you're gonna realize that these are the salient points that you have to pay attention to. Those are the specific areas every teacher will be focusing on, the USPs of a particular subject, what are the key areas from where the examiner picks up the question, how they confuse you between option A and option B, how you will pick up the answer A, why you will not pick up the answer B, why you will smile when you're picking up an answer as B, A, and knowing that the
Why the
people
examiner
with
put the
superficial
option A.
knowledge will be picking up as B,
Yes, B.
right? And that is not just going to happen in the exam. In the mid of your eh,
TND, you will start
preparation,
having that.
you will start having that. But this will happen when you will be giving the test, when you will be attending the live discussion, right? जस्ट merely बाइंग द कोर्स एंड थिंकिंग हाँ कोर्स बाय कर लिया अब तो हो गया, ऐसे नहीं होगा, राइट? आर यू गेटिंग इट? सो द पॉइंट इज take it and use it judiciously is something that is gonna help you, right? Chalo. So that's all. Bache, all faculties will be DBMCI faculties, right? So you go to the DBMCI one, you will see the list of the faculties that are there. All the DBMCI faculties are gonna be there. Who's gonna be taking? All faculties are the part of the DBMCI one. we'll be taking up these discussions for all of you. राइट चलो सो दैट्स ऑल। एक मिनट, मीर महनाज को देख ले बच्चे, बात करी ना आपके बारे में, आप बीच में गायब हो गए थे क्या? मीर महनाज, वी स्पोक अबाउट यू ना। राइट द जीटीज इन द एग्जामिनेशन एटमॉस्फेयर, है ना, कंडीशनिंग करनी है अपनी, एंड द मोर कंडीशनिंग यू गोना डू, बेटर you will become, right? Chalo, so that's all guys, thank you very much for bearing us for 1 hour, right? It's been nice interacting with you all. Please let us know if we can do anything else for you, right? Chalo, may God bless you all. Mm,